That so-called light at the end of the tunnel just got a little brighter today with a second company filing for emergency use authorization of its vaccine. But the part of the tunnel we're in now is getting even darker, as the nation's top infectious disease expert is warning of surge upon surge of COVID cases in the weeks ahead. First, let's focus, though, on the bright spots. Cambridge-based Moderna's CEO is targeting December 21st as the date for their first vaccine injections, if all goes according to plan. And new expanded data shows that not only is it 94% effective at preventing the spread of the virus, it's 100% effective at preventing severe COVID cases. Pfizer is looking at a similar distribution timeline after filing for FDA authorization about a week ago for its vaccine, which has proven to be around 95% effective in trials. But as for the third candidate many were counting on, some new issues have come up. After AstraZeneca and Oxford University announced last week their vaccine was showing an overall success rate of 70%, with lower dose method showing about 95% success, we've since learned that that lower dose method was, in fact, the result of an accident that gave people half doses, and that everyone affected was under age 55, which may have skewed the results. So now, a second global trial is likely needed. Meanwhile, in the here and now, the situation is quickly getting worse, with more than 35,000 deaths and 4 million new COVID cases in November alone. That's double the record set in October. Hospitalizations reached a new record of 93,000 yesterday as well. And overall, deaths are averaging out to almost 1 per minute in recent days, according to data from the COVID Tracking Project, as we're getting dire warnings about what lies ahead from the likes of top doctor Anthony Fauci.
What we expect, unfortunately, as we go for the next couple of weeks into December, that we might see a surge superimposed upon that surge that we're already in. We're going to have to make decisions as a nation, state, city, and family that we're in a very difficult time, and we're going to have to do the kinds of restrictions of things we would like to have done, particularly in this holiday season, because we're entering into what's really a precarious situation.
But there isn't a whole lot of hope for that kind of willpower after what we saw over Thanksgiving. Nearly 1.2 million people passing through airports yesterday, the most since the pandemic began. Nearly 7 million traveled by air in all in the week before the holiday, and there were plenty of indoor gatherings with family and friends along the way. Here in Massachusetts, more than 80 cities and towns are now considered high risk, despite the state changing those guidelines, and hospitalizations have more than doubled since the beginning of the month. So state officials are preparing for the worst and readying field hospitals across the state once again. But should we be doing more to stop the spread in the first place? I'm joined now by Dr. Bhadelia, an associate professor at Boston University School of Medicine and the medical director of the Special Pathogens Unit at Boston Medical Center. Doctor, it's good to see you as always.
Good to see you, Jim.
New England this weekend, Vermont was doing well, no more. Rhode Island hospitals are allegedly at capacity. And back here in Massachusetts, we have a governor who's a data-driven kind of guy. Our mask usage apparently is in the top 5 in the country. I'll put up a little chart here. Why have we had such a hard time in Massachusetts, Doctor?
Well, Jim, I think it's a combination of factors. One is, we knew that with the change in the weather, the transmission of this virus is going to be a bit more efficient, and we're moving indoors, so we're allowing the virus to transmit a bit more. The other is there really truly was pandemic fatigue where, yes, people are wearing masks, but you hear stories of still, as you said, over the holidays, people gathering. But even before the holidays, these small family gatherings or small group gatherings potentially contributing to cases. The last bit of this is we are not an island. We exist in this greater country, and we're seeing a widespread fire of the kind of resurgence in cases of everywhere around us. And so unless we're closing down our borders completely, we're going to see the effect of the pandemic in the rest of the country in the state.
Another place where on paper, statistically, we appear to be doing well. The Globe published a survey a couple of days ago showing we are testing more per capita than any other, 3 states more than us, Rhode Island, Alaska, and North Dakota, of all places. Yet we read reports every day, and I'm sure you hear them from patients. I hear it from friends, family. No one can get a test. Or if you get a test, you wait for hours and hours. Where's that falling apart?
Yeah, there's a couple of different things. I mean, I think the kind of increased amount of testing that you're seeing in Massachusetts, we currently have enough testing for people who are symptomatic or in the hospital or, potentially have the disease. The parts that we're struggling are people who are asymptomatic, don't yet have the symptoms, traveled recently, and the trouble with that is in some aspects of our society, like universities or private businesses that have taken this on as part of their charge against the pandemic, that we've done really well. There are other aspects such as, community-run programs for increased testing in areas that are heavily hit, including many of our minority communities. We're doing okay at that. It's when the demand has gone up, as we've seen with the holidays, with more people trying to get tests before we travel or coming back and getting tested. As that demand goes up for the asymptomatic testing, I think that's partly where we're struggling currently.
Joe Biden has talked a lot about how one of the focuses once he takes over is testing. He takes over on January 20th. The assumption is even if he wins 2 Senate seats and has the Democratic majority, they can't pass a measure on January 21st. Is Joe Biden going to be in the game too late to even have an effect on testing in America?
Well, I hope not. Well, I do think that the darkest weeks of this pandemic are unfortunately ahead of us. And there's only so much the transition team can do currently, but there are ways that not so much directly on testing, but the current Biden administration can actually have an impact. One is having a unified message about the importance of this pandemic and the fact that this is a threat, and then having people, take those measures that we're all talking about. But the other is actually getting states into some level of consensus. Different states are taking different routes with the same amount of viral transmission or community transmission within their borders. And some states are not taking mask mandates, others are. Some states are following some, guidelines to reopen or roll back reopenings, others are not. And so having that very disparate strategy, no national playbook, has left even the public confused about what to expect when cases go up. And will schools close? Will bars close? When will they close? I think that the Biden campaign take that period currently to work on building that consensus.
I want to talk about the federal versus state tension. The Advisory Committee on Immunization Practices is going to meet tomorrow with the CDC to issue recommendations about what the priority order should be as to who gets it. My understanding is Friday is the date states have to submit their plans to Washington, and states make the final decisions. Is that not correct? Okay.
That's correct. So, yep.
What's your expectation for Massachusetts? That it's healthcare workers, essential workers, and then older people in that order?
Yeah, generally, states do follow the CDC's Advisory Committee for Immunization Practices recommendations. So, I mean, given what we've seen previously with, yes, we don't live in normal times anymore, but when you look at H1N1 or other vaccines that were released, generally it is the recommendations of the CDCs that are followed at the state level. If that's the case, the 1A phase, as you described, it is healthcare workers, frontline healthcare workers, and some residents of long-term facilities. Now, this is an important component because people hear the fact that the vaccine is coming and, we start to let our guard down. But Jim, I want to share some numbers which might give people a sense of how long it might take even here in Massachusetts in terms of getting general population vaccinated, right? So in this country, there's about 20 million healthcare workers. So what Mansa Salawi, the Operation Warp Speed's co-director, has said is that we'll have about 20 million people vaccinated in December and then about the same every month on out. And so if you count the number of people who need vaccinations, 20 million healthcare workers in this country, you have, I'm going to read this so I don't get it right, 53 million people over 65 in this country, about 80 million essential workers in that larger group who need it, and another 100 million that have medical conditions that put them at high risk. So if you're a young, healthy person that doesn't fit one of those categories, just count it out, the number of months it might take to get to the regular population getting vaccinated. Now, the things that could change is that our manufacturing capacity somehow magically improves because we put more resources in there, or we get more candidates, vaccine candidates that come through that seem to be promising, that could actually be put into the mix as well.
Well, the guy who's in charge of supply and distribution for Operation Warp Speed, I think, said just today that his expectation is that every single person who wants the vaccine will have access to it by June. Do you buy that?
I think if you play out those numbers, You could potentially. I mean, this is
Okay.
hard to know because if you stick by that 20 million a month, but the devil's always in the details. And the one thing
Of
that we've
course.
found is that you can say you have these distribution plans, but things fall through, and there, you have to expect delay. As an emergency responder, I always expect delays and potential problems, and being ready to resolve those.
I want to end with the details. I'm so glad you brought that up. Those numbers you mentioned a minute ago, I think there are 350,000, for example, healthcare workers in Massachusetts. Let's assume I'm right for argument's sake. But let's assume there aren't 175,000 times 2, because everybody gets 2 doses, available right away. Who makes the decision as to which healthcare worker gets it and who doesn't? Who makes the decision as to which long-term care facility gets it and which doesn't while they're trying to complete, as you call it, 1A? Who makes those decisions?
Yeah, so the states have actually, my understanding is the states have asked facilities to forward those names. So they've asked hospitals and long-term facilities to forward those names so they can make that assessment. And Massachusetts has a vaccine commission, has a board that's going to determine just that. The plan then is once those names are given in, then you see that distribution. And in some cases here in Massachusetts, from what I hear, particularly with the long-term facilities, the state may actually call the National Guard in to help set up the logistics and distribution and the administration sites.
I only have 30 seconds left. How are you and your coworkers holding up when not only have you lived through this for 8 months, but know, as you say, that we have probably the worst 3 months ahead of us?
It's hard, Jim. It's hard because we know that the fight doesn't end January 21st. We're in this for quite a few months until we see population level, immunized herd immunity, which we're not going to see. And not only that, but we may be slightly better off than we were in the spring. My concern is that when we see what's going on in the rest of the country, it's eventually going to make it through our borders as well.
Doctor, good luck and good health. I appreciate your time. Thanks so much, as always.
You too, Jim.